So, thanks for the opportunity to share my early research thoughts. What I plan to do over the next 10 minutes or so is briefly explain the background and rationale for the study, why I think it's important to healthcare regulators, some of the limitations of the existing systems, and what role I think social media might play in the future. I'll also outline my research question and give a brief summary of the planned methodology. I've also got one or two queries that I'd like to pose to the group at the end of the presentation, just to get your input and advice on a few areas that I need some further work on. And I'll leave plenty of time for any questions at the end of the presentation. So, no doubt that 2013 was an annus horribilis for the National Health Service in the UK. There's been an array of high-profile publications about the quality and safety of healthcare, which has really served to heighten public awareness and shine a strong media spotlight on the care that's delivered in the NHS across the UK. Excuse me. I put up a picture here of Julie Bailey and our fellow campaigners following publication of the damning report into Mid Staffordshire Trust failings, but this is really only one example of a number of publications that came out last year highlighting concerns about the quality and safety of care. And for me, there was a recurring theme in all of these publications, and that was a failure to listen to patients and an inability to act promptly on their feedback to improve care. And here's a quote from Robert Francis, who chaired the Mid-Staff's inquiry, saying that results and analysis of patient feedback needs to be made available to all stakeholders in as near real time as possible. So, why measure patients' experience of healthcare? Well, I would argue that measuring quality of care through the patient's eyes is crucial. The timely measurement, interpretation and analysis of the experience of patients and families is essential to understanding what's working well, identifying what needs to be improved, and also showing how we might actually go about improving things. And research shows that those patients who have a positive experience are more likely to trust their clinicians, are far more likely to follow treatment recommendations and treatment regimes, and are actually less likely to die following a major clinical event. There was an excellent systematic review of evidence published by Doyle et al. Last year in 2013 that indicated consistent positive associations between experience, safety and clinical effectiveness for a wide range of disease areas, settings, outcome measures, and across different study designs. So why is it actually important to regulators, which is where my interest comes in? Well, traditionally as regulators, we've used quantitative process measures and clinical outcome measures to assess performance of healthcare organisations. But experiences of patients and families and carers has really been a missing component in our scrutiny activity. But patient experience helps regulators to understand the current problems that are ongoing in care delivery, to allow us to quickly spot trends and identify major risks to the quality and safety of patients, and as a smoke detector or early warning, if you like, of potential patient safety and quality issues. As regulators, what we need to do is bring together this quantitative and qualitative evidence into a coherent statement of the quality of patient care and experience. So, what's the problem with some of the traditional measures of patient experience? Well, mainly they're paper-based. They ask a limited amount of questions. They're in the main conducted infrequently. Certainly in Scotland, the Scottish National Patient Experience Survey is conducted only once every 2 years, which you could hardly say is real time, and they're expensive to administer. Our national survey costs in excess of £2 million to run, so they're not cheap, and I don't believe they give the best value for money. However, social media is changing the nature of health-related interactions, and social media is more than just a tool. It's a conversation, and I feel it's one that healthcare organisations need to join. Patients and carers are using Twitter, Facebook, blogs and rating sites to instantly comment on cleanliness, communication, safety and the quality of their care episode. And this largely untapped resource holds great potential for healthcare organisations, and I think particularly for healthcare regulators. But it's important to emphasise that this information can't be used in isolation. But I do think it could form a valuable part of intelligence monitoring and analysis used by the regulators. And patient stories permeate the internet and the atmosphere at the moment. Social media is viewed by many as the new frontier for communication between providers and patients. And it really is a new and evolving area of research. And I've captured just 3 bullet points there highlighting recent research publications around the use of social media, patient experience in healthcare. PwC PricewaterhouseCoopers did a national survey in 2012 and showed that 44% of patients are likely to share health experiences via social media now. An excellent paper by Timmy et al. Last year in 2013 looked at the number of Facebook likes and showed they have a real strong negative association with the 30-day mortality rates. And a paper by Felix Greaves and his team at Imperial College in London highlighted that patient experience captured through social media has the potential to provide an early warning system of poor clinical care for use by regulators. So a lot of work going on around social media and how it can be used in healthcare. So the research question: how can healthcare regulators use patient experience captured through social media to detect poor performance and identify areas for improvement? A few potential sub-questions that I'd want to look at. So starting with what systems are currently in place and used by healthcare regulators to capture real-time patient feedback. What do we see are the enablers and potential barriers to using patient feedback captured through social media? What are the views and opinions of not just the regulators but of patients and clinicians on this type of data capture? And then, could this type of information actually be used as an early warning of quality and safety issues? The plan around methodology is to adopt a sequential mixed methods approach, and at this stage I've broken down the methodology into 2 distinct stages. So at stage 1, the intention would be to undertake an online survey of healthcare regulators across the UK, some in Europe and 1 or 2 in the States. And I would be able to link in with our extensive networks that we have of healthcare regulators across the world, so no problem tapping into that group there. I would also want to follow that up with a semi-structured key informant interviews and focus group discussions with groups of healthcare stakeholders, just to build on the information that's coming out of the survey and to look in a bit more detail at the views and opinions, motivations, etc. of this group. And then a focus group session specifically with our public partner group, which are lay people involved in the work at Healthcare Improvement Scotland, to explore their views on the use of patient social media comments to inform healthcare regulators. In stage 2, this is where I might be getting a little bit over-ambitious. Part of me wants to go beyond the phase 1 research and do some feasibility testing of this type of information capture and analysis. I think it would be of great benefit to my own organisation as well as to the other healthcare regulators throughout the UK and Europe. It would need to be on a small scale, obviously, possibly looking at just 3 or 4 health boards in Scotland. And I'd like to look at using sentiment analysis tools, which are basically software algorithms that scan free text comments and group them into positive and negative. And you can apply keywords to the algorithms to identify particular issues you're looking for, the likes of cleanliness, communication, etc. So, this stage 2 of the study would be looking at the feasibility of capturing real-time patient experience, the actual relevance and utility of this information in supporting safety and quality of healthcare, and the overall effectiveness of the analysis in identifying the signals, and whether it's actually possible to separate out the signals we're looking for from the general noise that goes on across social media all day. In terms of questions and queries, I've just put up 3 bullet points that I'd be interested to get people's feedback and thoughts on. Firstly, around the scope. Have I bitten off more than I can chew? Should I just be sticking to phase 1? I mean, clearly I think phase 1 would be sufficient for the doctorate. There's a lot of excellent, useful information here to be captured. Perhaps the pilot of the sentiment analysis could be a step too far. Maybe that's something that should be considered after the doctorate. In terms of methodology, if I were to go down the route of a 2-stage project and do a pilot, I think it would lend itself more to an action research approach, and that would allow me to more than just understand the views, but actually to generate some potential solutions, which is very attractive, but it may not be possible within the time frame. And lastly, ethics. Social media research is clearly an emerging field, and retaining the privacy and anonymity of social media users is very important. Clearly, patients haven't consented for their unsolicited comments to be collated and analysed and published. And in effect, we're turning them into research subjects without their knowledge, so that would be an area that would require further consideration. But thanks for listening to the presentation. Happy to take on any queries if anybody has any. Thank you very much.